A beautiful place for us, by us, that's been saving lives quietly and humbly for the past 40 years.
Quiet and humble, but there's no denying the impact of this recovery center. And now they're getting new support to help even more people get to the other side of addiction.
Yeah, the folks behind this mission have seen firsthand what addiction can do to families in Boston communities where help can be hard to come by. And they're making sure everyone has a chance to find a way out and change their lives forever.
So when you're stuck down in a deep, dark hole and somebody shines a light and puts a pathway for you to get out of that hole, it's your obligation, your responsibility to be that same light for somebody else to come out that hole.
Lovely Harvey knows about the deep, dark hole. He lived it.
Homeless, helpless, hopeless, and not caring about tomorrow. I ended up in the wheelchairs, in the hospitals, in the prisons, the overdoses. Everything that could go wrong that adds up with active addiction is my story, besides dying. And I came pretty damn close.
Harvey knows he could have been a statistic if not for one man and one program in the heart of his community.
Mr. Davis used to walk by me and see me in Nubian, killing myself every day, using substances, and would say, you know, it's okay to come home.
We have recovery meetings here.
Home was Metro Boston Alive, and Mr. Davis is Gregory Davis, a man who has helped thousands of people just like Harvey find their way out.
Ron Hill was my first person I mentored in his journey of recovery.
Davis remembers all the names, all the faces, people he helped, and people who may be gone.
We provide clinical care.
Now, through a partnership with Mass General Brigham, he's expanding that effort.
And they wanted to really start to put some focus on the community of color that has been really invisible for many years in terms of getting resources and support.
Building trust wasn't easy, but Davis says when MGB sent their mobile health van right into the Roxbury community, things started to change.
I can say to someone, you know what, you need to go in that van because did you get your blood pressure done? No. Did you do this? No. Go in that van right now. It's a small but powerful step. It's not the solution, but it's towards the solution.
Why aren't people?
Jasmine Irvin has been a key part of finding that solution. The Dorchester and Roxbury native is the senior program manager for the substance use disorder health equity team at MGB.
We saw the horrible numbers, health outcomes that were happening in our community, particularly around substance use disorder. So we knew that we had to do something.
She knows getting her team into the communities that need them most was critical.
So it's really boots on the ground, like getting in here and rolling up your sleeves and doing the work, touching a lot of people who we may not ever come into contact
Absolutely.
with.
Lovely Harvey has seen what this partnership can do and says it makes all the difference.
Many lives have been saved and changed because we meet people where they're at.
Now, Jasmine Irvin there said they're just getting started. Her Mass General Brigham team really wants to increase that visibility in Boston's black and brown communities, bringing that help to their front door.
And Metro Boston Alive, by the way, has helped some 20,000 people out of addiction over the past 4 decades. You can learn more about their incredible work with this story on our website and WCVB app.